Malik, today, as the summer already set in, we will talk about summer related problems, mainly the heat related problems. Number one is heat exhaustion. We are seeing number of cases. That is, number one is heat exhaustion. That is, it is a mild form of sunstroke. It is a mild form of sunstroke where the patient is totally dehydrated, the tongue is dry, and the patient feels very weak, very weak. Probably 90% he doesn't require much of treatment except give him plenty of ORS, that is electrol. The ordinary term is electrol, ORS. So ORS or electrol put in water, give plenty of water with electrolytes, that is electrol or ORS, what we call it. So please give him plenty of fluids, ORS, and take him to a place where it is cool, and if possible completely smear him with water, dry, wet towel, complete wet towel. If possible, have a bath, or just use a wet towel throughout the body. Just wipe the body with a wet towel. This is important. 90% it will come down. Next it goes to heat hyperpyrexia. Heat exhaustion is the basic, is the main thing. And then if untreated, it is not treated, it goes to heat hyperpyrexia. What is heat hyperpyrexia? The patient develops very high temperature. The body regulatory mechanisms of heat will fail. So naturally, he goes to very high temperature. The body rises, the patient will have very high temperature and some amount of disorientation. The patient may not have much orientation. The patient may be confused. So dry and with high temperature, this patient needs immediate hospital admission. Mostly you can give oral fluids if he is able to take oral electrol and oral fluids. He can take plenty of fluids with little of electrol in it, one spoon in each glass. You can just go on giving it until he becomes normal, or you have to admit in hospital to give IV fluids like normal saline, Wenger lactate, DNS, dextrose with normal saline. These are the IV fluids we give, and we cool down the patient with paracetamol. We give IV paracetamol injections, and at home also you can give this Dolo 650 tablet like that. You can repeat also. You can give one tablet. If the temperature is not coming, you can give another tablet. But if the situation is progressing, heat hyperpyrexia can go to heat stroke. Heat stroke is a dangerous condition. That is full-fledged sunstroke. Heat stroke where the patient is sometimes not conscious or sometimes very disoriented, just irritable and unable to breathe properly. So many things. The patient slowly is going into coma. So please, immediately you have to admit in the hospital, give IV fluids, bring down his temperature to normal, and he needs intensive care treatment. And one more thing we frequently encounter these days is food poisoning. Food poisoning is very common. Food poisoning doesn't mean that there is some poison in the food. No, the food gets damaged. Because in summer food gets easily damaged. Try to be careful regarding the food. Don't take morning cooked, evening cooked, next day morning. Let us be little careful. At home it is little okay, but outside stored food is very dangerous. Outside stored food, for example, you go outside, you have to eat outside sometimes. So take only fresh things. Don't take those in hotels they give some chutneys and all which are stored. Please don't use, particularly in hotels. At home it is okay. In the house there are some pickles which are made, that is very good, but in hotels the pickles are very dangerous. They are not properly stored. That is the biggest thing. Be careful about outside water. If possible, try to carry your own water. If possible, the water in which you are carrying, suppose you are in hot sun, you can mix little salt and little nimbu, that lemon, so that it will be tasty. Little salt and little lemon, that makes it very nice water for, it is just like ORS. So that can be done. it is something like electrol, or otherwise you can mix little of electrol. But if you are a diabetic, only salt and lemon, only salt and lemon. Don't use electrol may contain sugar. So sugars, don't use sugars, use salt and little lemon. Take it, if possible, 2 liters bottle you take it, at least 3 liters to be consumed per day. In normal days only we consume 2 to 3 liters minimum. So here you have to consume little more. So be cautious about that. Take your own water, or be cautious in outside water. When you are going out, water should be taken care of, and the food you are eating outside, it should be taken care of, because particularly in the food, the chutneys and all which are little damaged can cause problem to you. You can land up in gastroenteritis. See, usually there are, once upon a time we used to call it cholera, because those days it was very, very common, because the water supply was not good those days. Long back, I am talking about 70s, 1970s and 80s. We used to see cholera. Cholera is caused by Vibrio cholera, one organism, one small bacterium. So Vibrio cholera, yes, it's a small microscopic organism, and particularly it used to cause it is through waterborne disease. It is through uncontaminated water. In summer particularly, water was not available in villages, very difficult to get. They used to take contaminated water. That was the cause. But nowadays it is little less. I don't say it is totally gone, it is little less. But now we are not using the term cholera, we are using gastroenteritis. Gastroenteritis. This is also caused by, this is also a waterborne disease, and particularly the patient will have loose motions, vomitings, etc., etc. All the things. Particularly there is one condition called acute gastritis. Acute gastritis can be caused sometimes by chemicals. Usually what happens in marriages, etc., etc., sometimes at home also, there are big vessels which are used for cooking, and at the bottom of the vessel there will be some amount of chemical. You can understand, bottom of the vessel, when all the food is over, they are taking from the bottom, there will be some black areas that causes some chemical. So that is dangerous. If the food contains that particular black thing which is taken from below the vessel, that can cause chemical poison which gives severe symptoms within 6 hours. Once you consume anything and immediately within 6 hours you land in severe vomitings, that is usually chemical poisoning. Within 6 hours, you take some food, you get symptoms within 6 hours like severe vomitings. This is called chemical poisoning, and only thing you have to do is you have to come to the hospital immediately, where you will be given IV fluids, because there is one condition called hypochloremic alkalosis. The vomitings will be severe, continuous, so that you land in this chloride. HCl, hydrochloric acid, will be there inside the stomach. That chloride ion will go out, continuously because of vomiting, and you may land in hypochloremic alkalosis like tetany. You will have tetany, this cramps, whatever tetany, we call it tetany, cramps. So please, immediately you have to come to the hospital, where we give IV saline and reduce your vomitings with injection pantoprazole, injection ondansetron, or injection Perinorm, or injection ondansetron, injection Ondem we call it. We give it, and we injection pantoprazole to reduce the symptoms, and IV fluids, particularly NS and DNS. These are the things, normal saline and dextrose with normal saline, to reduce your symptoms. So this needs hospital admission. And another condition is gastroenteritis. In this also you can have vomitings. Gastroenteritis is vomitings and loose motions. Usually this happens in gas. Sometimes you may present only with loose motions. Sometimes there will be vomitings and loose motions. Usually the best thing is, and this is also because of waterborne disease. Some food got damaged. You have taken some damaged food or stored food or something like that. So it can be because of some bacteria or virus, which is there in that food, some bad bacteria or virus which is not compatible to the body. Usually there are plenty of flora, plenty of bacterial flora inside the intestines, but sometimes there are some bacteria, dangerous bacteria also, which are there in the food, which is damaged. So please, gastroenteritis to be treated very promptly. Initially, if there are only some loose motions and just 1 or 2 vomitings or just loose motions, you can take some medications, like you can just give him coconut water or electrol or ORS. That is a must, number 1 treatment. Number 2 is you can take medications like ofloxacin with ornidazole. Oflox OZ is the tablet. Oflox with ornidazole. This prevents. This will treat bacterial problem. Virus, nobody will medication for virus, but this bacterial problem can be treated with ofloxacin with ornidazole. Oflox ornidazole tablet, 1 in the morning, 1 in the evening. And to control motions, there are some capsule. Redotil is there, tablet. Loperamide, that is Andial. Okay, Redotil, capsule Redotil is there, and tablet Loperamide or Andial is there to control the loose motions immediately. They can be taken like 3 times a day like that, but till the motions are controlled. And if there is pain in the stomach, you can take tablet Buscopan. Which is routinely taken. Please give it. And if there are vomitings, so if the patient is having vomitings, 1 or 2 vomitings, it's okay. You can give tablet Ondem or tablet Domstal, like that. You can. But thing is, most important is to hydration. Frequently go on giving fluids to the patient, oral fluids, till the patient can take oral. Even if there is 1 vomiting, doesn't matter. Give or little bit, let him sip water continuously, sip, so that at least 2 to 3 liters should be taken. Minimum per day 3 liters should be taken. Particularly if you are going out. See, if the gastroenteritis is severe, there are continuous vomitings, loose motions, and the patient is feeling damn weak or not comfortable, you need hospital admission. Immediately, where we give him IV fluids, because the BP will come down and he may, it can be dangerous. It can be life threatening also. So we give, initially you can try at home for small things, but once you see that the patient is not comfortable, please take him to the nearest hospital where IV fluids are given, like Ringer lactate, normal saline, dextrose with normal saline, and antibiotics. Same antibiotics is given IV, intravenous antibiotics, and the patient will be normal within 1 day or 2 days usually. Sometimes if it is virus, it may take about 3 to 4 days or even 1 week also. But 90% of the problems come down, but prevention is more important. Take plenty of fluids. Please carry water from home if possible. Outside water, be careful about taking outside water, and don't take any stored food outside. At home it is okay, but in outside, please be careful in taking stored food. Stored food is very dangerous. So particularly outside chutneys and all, they are dangerous. Take always fresh things when you go outside in summer. Always freshly cooked or freshly prepared things. Don't take stored things outside. Be cautious. This is the thing.